Today on Animal Outtakes,
Incoming to Sir Rocket.
it's a busy day at the clinic as veterinarians tend to animals of all shapes and sizes. Find out what it takes for these specialists to keep our pets healthy. Hello and welcome to Animal Outtakes. I'm your host, Marcia Panucci. From dogs and cats to birds and reptiles, veterinarians are tasked with helping to keep our pets healthy. It's a job that requires quick thinking and decision making because these medical specialists don't know what they'll be dealing with. Today on Animal Outtakes, we spend the day with one vet and experience the fast-paced atmosphere firsthand.
May I?
You may.
Oh, pretty small little Havanese, aren't you? Yes, you are.
Dr. Ann Chauvet is a veterinarian in Sarasota, Florida, specializing in neurology. Her first appointment today is with Jake, an 8-year-old Havanese whose owner made a 2-hour trip to see her.
Your major concern is the anal gland?
And the seizures.
Okay, I need to hear about the seizures.
Yeah. That's
Go
how I
ahead.
found you, with the seizures.
Tell me about the seizures.
Okay, the seizure started May 21st.
Jake's mom says he's had seizures a couple of times in the spring and was concerned about it, as well as Jake's walk.
So he does fall? He's always fallen and slide out?
Doesn't fall, he slides.
And that's always been this way?
Pretty much, yes, because he doesn't have the strength.
So he just hops on his back legs, you say? Mm-hmm. Okay.
And when we go for walks, he prefers to hang back a little and run up because the walking, I think, is more effort. So I walk ahead and then he zooms.
So what he has going on in his knees are his kneecaps out of place.
Is that a permanent thing? Is that the
Well,
problem?
they're not permanently out of place, but that's what's going to cause him to hop on the back legs.
After taking Jake's history and examining him, Dr. Chauvet thinks that there could be more going on with her patient.
I think he definitely has some brain issues. The question, the brain issues primary to the brain or are they influenced by something else? So here's what I would advise, not necessarily in that order, but I would advise that some kind of imaging be done on his brain. He has what we call open fontanelles. So his skull is infused all the way, and that's often a sign of hydrocephalus, water on the brain. Now, obviously, it's not severe. He still has a pretty good life, but it'd be nice to know if we can help that a little bit further, if we can confirm it's going on.
Congenital hydrocephalus is a birth defect where excess cerebrospinal fluid leaks onto the brain, adding pressure to the brain tissue. This added pressure can lead to brain damage and other problems. In dogs, it's most common with small, miniature, and toy breeds. Dr. Chauvet also thinks the seizures could be coming from a liver defect and suggests a blood test to check on that.
These little dogs can also have some shunts, we call them, which is an abnormal bypass of the liver. So when you eat, toxicities build up, and you have a liver, that's your nice little filter. And in some of these dogs, because there's a bypass, not everything gets filtered and toxins build up. The ideal thing for him is to actually check for a shunt and also image his brain. He's had seizures of late onset. He's 8 years old. He has abnormal gait. He has open fontanelles. He has signs of hydrocephalus on his exam. But mom wants to wait on that. There's a cost prohibition. So we're going to check the liver first, and maybe we'll get a little bit of help from that. Okay. I need pre- and postprandial bile acid, 1 hour ammonia. Thank you very much.
As the veterinarian technicians get to work drawing blood from Jake, Dr. Chauvet's attention turns to another patient, Rocket.
Hi, handsome. Hi, handsome. How are you? So good to see you. I'm good. Oh, boy.
Rocket is an American short-haired cat here for a follow-up.
He has cancer of the pituitary gland. The pituitary gland is in charge of a lot of hormones and a lot of control of our hormonal system in our body. The good news is that these large tumors called macroadenomas tend to be inactive hormonally, so it's not affecting his hormonal status, but it's occupying a lot of space in a small area in his skull, and it's slowly growing.
After traveling to Gainesville for radiation therapy to try and slow the growth of the tumor, Rocket's mom is here to see if the treatment worked.
My little monster, you're my main man. I'm so happy to see you. There you go, Miss Brittany. Incoming. This is Sir Rocket. Oh, he's one of my favorites. Take good care.
Rocket will be getting an MRI and CT scan done today. Since he's already stressed out, the technicians put him in an anesthesia box to make the prep process a little bit easier.
So the gas goes on one side. We have a high flow oxygen, a high flow of gas, and then it'll put him to sleep. When he's asleep enough, we'll intubate him and we'll put a catheter for his IV. We prefer to give the injectable rather than anesthetize right away, but it's not worth the cat's stress. He's really stressed and we want him to have as easy of a time with this. So that's why we call it a cat box. We don't seem to have the same problem with dogs, but with cats we do.
Meanwhile, it's time to feed Jake. For his liver test, Jake has to eat, but hasn't been interested in the food laid out for him. So that means he'll have to be hand-fed. Afterwards, it's a waiting game for Jake until another blood sample is taken in a few hours. Once Rocket is asleep, the techs fly in, get his IV ready, and intubate him ahead of his first procedure, the MRI. As they get him set up in the machine, there's another patient waiting for Dr. Chauvet.
All right, what you got?
Room 2, you have an 8-year-old female golden retriever who likes to chase possums. 11 o'clock last night, she attacked the possum, and then the possum ran away and fell in the canal. But after he bit her on her chest.
Okay.
So, and it's still bleeding a little bit. She's not gushing, and she's very sensitive.
So it happened last night?
Yeah.
And now they're bringing it? Okay.
Yeah.
Good. I'll deal with it.
Still ahead on Animal Outtakes,
All right, show me where you've been bit.
a dog's harrowing encounter with an opossum gets the full attention of the medical staff. Could this golden retriever have contracted rabies? Plus, a very special patient swims in for a checkup.
For thousands of years, we've been humans' best friend. You've been through a lot, and we've been right there with you. A dog is part of the family, a confidant, and a friend who always knows how to get into your heart. So what happens to our beloved companions when we can no longer care for them? This is why we've created Dante's Den, an innovative, state-of-the-art facility that will provide care for up to 100 dogs.
Dante's Den is a community for joyful dogs.
Millions of Americans face uncertainty when planning for the future of beloved pets who may well outlive them. Dante's Den is a charitable organization, so in whatever capacity you can, please lend your support so that we may continue this most wonderful work.
Dante and I would like to thank you for watching and for also opening up your hearts to our wonderful community of joyful dogs.
Learn about the many ways you could become involved by visiting dantesden.org.
It's that time of the year again. Time to grab the family and head out to Top Dog, a dog show like no other. Enter your pup in categories like Best Dressed,
And look at this.
Funniest Trick,
Wow.
and more. Join the fun at Top Dog Saturday, October 10th at the Sarasota Municipal Auditorium. Proceeds support Dante's Den, which provides a loving, home-like setting for dogs. Visit topdogsrq.org and get your tickets today. This is my new best friend, Turbo. Turbo is a mini Dachshund, about 11 months old. Look at that face. Isn't that precious? And full of life and love and happiness. Loves to run around and get exercise. Loves to go into the pool, but stays on the shallow end. Turbo also loves to get onto the agility exercise equipment and is just an all-around cuddly baby. Turbo is special, and is looking for a very special family. Perhaps Turbo can be your new best friend. A lot of animals come through veterinary clinics every day with a variety of ailments, like Libby.
So it doesn't take much to stimulate her. This is very common in King Charles. And this is not an itchy skin. It's just simply any stimulation around this area and she'll itch like crazy. And that's because of a malformation of her skull. So you can touch this side, doesn't seem as bad, but this side's pretty bad for her. So you hang on, Libby.
On this day, a golden retriever named Daisy has come by with a valiant tale of a hard-fought battle.
All right, what you got?
Room 2, you have an 8-year-old female golden retriever who likes to chase possums. 11 o'clock last night, she attacked the possum, and then the possum ran away and fell in the canal, but after he bit her on her chest.
Okay.
So, and it's still bleeding a little bit. She's not gushing, and she's very sensitive.
This happened last night,
Yeah.
and now they're bringing it? Okay.
Yeah.
Good. Hello, I'm Dr. Chauvet. How are you? All right, let's see. All of you. All of you. I know I'm poking and probing. That's part of the job. All right, show me where you've been bit.
Right there.
Yeah. So this was yesterday?
Although a bite may seem pretty harmless, they can actually cause a lot of damage.
So the wounds, when you have bite wounds like this, for the future, make sure you get them in right away. Because the bite wounds, not only there's bacteria in the mouth, but there's fat in all of us, hopefully, and the dogs. And the fat gets infected with bacteria or the muscle, and it can start creating a pretty nasty process. We call it steatitis. So we want to make sure we get these cleaned up really early.
Dr. Chauvet recommends cleaning up the wound and draining it, then putting Daisy in a hyperbaric chamber.
In an ideal situation as well, we actually culture what's in there, because we don't know what the mouth or what animal collecting. You know, it could be as simple as just some what we call gram-negative, but it could be much more.
In Daisy's case, she's lucky on one aspect. Opossums don't carry rabies, but it's better to be safe than sorry when it comes to bite wounds. After the evaluation, Dr. Chauvet leads Daisy down to the treatment room where the technicians prep her for treatment. Meanwhile, our feline friend Rocket has finished his MRI and is moving on to the CT scan. While both scans offer detailed views of Rocket's tumor, the images produced vary. CT, or computed topography scans, are good for looking for tumors, like Rocket's, while magnetic resonance imaging, or MRI, shows the differences between normal and abnormal tissue much clearer. Doing both tests gives Dr. Chauvet a more well-rounded view of the status of Rocket's tumor and if the treatment is working. Back in the treatment room, Daisy is under sedation and ready for Dr. Chauvet to drain her bite wound.
There's a nice pocket here. But we always want to find the biggest pocket, the deepest we have. So I'm going to go as high as I can, so it's a high to low when we drain.
Would it be categorized, doctor, as a puncture wound?
It is a puncture wound that has formed some cavitation or pocketing. It's pretty impressive. You can have pockets that are about 10 centimeters deep on either side of the actual tiny little bite wound that looks insignificant on the outside. You can see how much damage one bite wound can do in one night. So it's dissected right to the muscle and the fat. Well, not so much muscle in this dog, we're lucky, but right to the fat. So you can see how much all of this is dissected from last night. So when you have bite wounds, it's really, really important to get them taken care of ASAP because they are big problems.
After the drains are placed, they are trimmed and then sutured in place. But this is just the first step in Daisy's treatment.
So we're going to load her with an antibiotic injection, put her in hyperbaric on wake up, and then she's going to feel like $1,000,000 after. The owners are in charge of keeping this clean and dry, and they can put a t-shirt on her, so it helps as far as cleanliness. But in about 2-3 days, it's likely they'll be able to have their vet pull the sutures and pull the drains.
Coming up next on Animal Outtakes, not all patients are your traditional pets. We'll tell you how veterinarians are helping treat this endangered sea turtle. Stay with us. We'll be right back.
And now it's time for Tales from Dante's Den.
Fiona loves the water. But Fiona hasn't always been the best swimmer.
She sinks like a rock.
A lesson Dante's Den volunteer Austin learned the hard way.
When we bring him back to the community, when she saw the water, the leash came out of my hand and she belly flopped in the pool.
At 55 pounds, this American Staffordshire Terrier is more muscle than anything else. Her first time in the pool, Austin had to dive in to help her out.
I lifted up her back end until she got to where she could stand.
Acting as part lifeguard and part swim coach, the 11-year-old taught Fiona some pool safety tips. And now she swims like a pro. When she's not in the pool, she loves to play catch.
She loved the frisbee. She'd jump up in the air and grab the frisbee with her wide mouth.
Austin says there's one thing he thinks Fiona's next owner must have.
They definitely have to have a pool.
While most patients who come through the clinic doors are dogs and cats of all sizes, sometimes you see something surprising, like a sea turtle.
All right, when did this happen?
This is a young Kemp's Ridley sea turtle, one of the most endangered species of sea turtle in the world. Nicknamed Squirt 2, he was found in the Peace River in April 2015 with a boat strike wound to the face, among other medical problems.
He looks pretty good.
He does. He can't. That jaw's broken, so he
see
does
the
eat, but it's hard. He can only
scar face, huh?
can't get it open very.
Scientists brought him in today to get a CT scan of the skull to better understand his injury.
So let me show you how this is going to work.
Okay.
We're going to have your turtle on the table.
After laying down towels, Squirt 2 is brought in and hoisted onto the platform.
All right, how's it going? Is she tolerating?
She's calm. Yeah.
All right, let's see if we can slide her down a little bit. That's almost
Slide her this way.
more towards the back, yeah.
In order to get a good image, the patient must remain still inside the machine, something that is hard to ask a turtle to do. As a precaution, Squirt 2's front flippers are taped and a towel is placed over his head.
Okay, the only thing that'll interfere with the scan will be her motion. So I'm going to have to wait until she takes a breath to begin scanning. Do you know what I mean? Because I don't want her to run into... 20 minutes is a great amount of time for me to scan. I only need like a minute.
Moments later, Squirt 2 takes a breath. So Dr. Chauvet gets started.
Okay, here we go. The biggest one is her head, because if she moves that, I'm in trouble. So we'll hope she doesn't move it while I'm scanning. 31 seconds. That's normal. Did she move it?
She's breathing.
After a quick reset, Dr. Chauvet tries again.
don't move now. 31 seconds, not even. 20 seconds. It's perfect. We got her little beak and everything. So cute. Little turtle beak. Hold on. 11 seconds, 10 seconds. Did she move?
After taking the towel off his eyes with no luck, a new method is suggested to keep Squirt 2 still.
Becca, can you stare in her eye?
You hypnotizing her?
Yeah.
A couple minor adjustments, and they try again.
Here we go. Take 5. Take 5. Turtle CT.
And it works.
You're a good starer. Don't let it go. She's a turtle, what do you call him? Whisperer. Bubbler. Wouldn't it be a bubbler?
It takes minutes to finish scanning the rest of the turtle, and then Dr. Chauvet shares the results.
So you can see all her skull.
Wow.
Well,
That's
so it's all the
amazing.
way in his
Yep.
skull,
You can
in his
see.
head.
So all of this is not normal, right?
Right.
No.
Yeah, so you can see that now. And we were able to see how deep that wound was actually. That wound is actually severing your entire jaw.
Oh, that's why.
Yeah. So the question is what they're going to do about it now. We'll defer to the doctors and whether they want to do any procedures. But this is why she cannot move that jaw, because it is constantly, it's detached from its base, and
severed.
it's got even what we call sequestrum, pieces of bone that have been isolated and are now kind of floating on their own.
As far as repair, it's up to the sea turtle's doctors and scientists to determine the next step.
I'm sure this could be fixed. I do not know to what extent they'd be able to do that and who would be able to do that. It's quite a challenging area because it's fairly deep. It's very much by the base of her neck as well.
After Squirt 2 gets his diagnosis, it's time to check back in with the other patients. Rocket's mom is back and ready to learn whether or not treatment for his cancer is making a difference.
Here's our tumor. Okay. And here's the tumor there. Okay, so the best thing to do right now is doing well. I would send this to university. Okay? I'm going to measure it so I can put the other one in. Let me know if it's grown. It has grown.
Our dear Rocket, who is really struggling but doesn't look like it.
Well, Rocket is our sad story of the day. He has cancer of the pituitary gland. Unfortunately, today we found that the tumor is yet bigger. So it has continued to grow, although slow. It's still there, still present. His prognosis is at very best poor right now, because the long-term outcome will be that this cancer will win. But what is long-term for Rocket? It could be a year, could be more. So we have to decide in the quality of life of a dog, of a cat of that age, you know, is that a reasonable outcome? And I think actually of the tumors he could have in his brain, as unlucky as he is probably one of the better ones, slow-growing tumor.
Now we move on to Daisy. Daisy, who fought a valiant battle against an opossum.
I don't know if the
and
possum
won.
agrees, but
Well, probably long since gone, but she got the worst of it.
she did get bit, and it's a big issue when you look in Sarasota and neighborhoods. There's a lot of possums, there's a lot of raccoons, and the dogs want to fend for their yard, and they get into these fights and these battles, and we have to take care of their wounds. Some of the difficulties is that they get bit and you don't really see a lot of damage. You see maybe a little blood in the fur and you think it's going to be okay. And so often the owners will wait until a few hours, a day, sometimes more, and then dog begins hurting.
And what's Daisy's prognosis? Because she's
Excellent.
been up and around.
She's up and around. She's got little, drainage coming out of her. She's going to go in a hyperbaric chamber. This will help as far as making her recover faster. We'll give her antibiotics prior to going in the chamber. It will help the antibiotics penetrate in that wound, and she should have a pretty swift recovery and have those drains pulled out in a few days.
How about Jake? Tell us about the prognosis on Jake.
So Jake is still a little bit of a mystery. He's this little Havanese has been bred to be small, and along with that, a lot of times come complications such as congenital anomalies or malformation, if you may call them. What I suspect Jake has most likely is hydrocephalus, which is water on the brain, but I won't know that unless I do an MRI. So we're trying to rule out other things. There are simple things like a liver shunt that could explain some of his behaviors. If that doesn't pan out, then most likely we'll have to pursue an MRI. So his prognosis is most likely Jake is going to end up the way he is, stay the way he is, and hopefully not have too many seizures because of his problem in his brain.
Stay tuned for more Animal Outtakes after the break. Animal Outtakes is produced by Dante's Den Foundation, a nonprofit group dedicated to creating the best life for dogs. If you would like to learn more about Dante's Den, donate, or volunteer, visit our website, dantesden.org. Well, that's it for this episode of Animal Outtakes. We hope you've enjoyed our day out at the vet and learned a little about what goes into this demanding career. Join us again next week for another outstanding animal adventure.
I can't afford it. Cat and box, better known as a Tupperware. Last Tupperware party I went to, I wanted to make sure it had the right holes on each side. Just kidding. But it's basically an anesthesia box. You can buy fancy ones in glass, or you can make one with a Tupperware. We have both types.